When placing a peripheral IV or collecting blood, a tourniquet helps improve the success rate by making the veins easier to find. To apply a tourniquet, choose a washable or single-use one. There are several types available. Place a tourniquet 5 to 10 centimeters above the spot where you plan to insert the needle. Make sure it's tight enough to slow down the blood flow in the veins, but not too tight. It shouldn't cut off blood flow in the arteries. If it's too tight, it can actually make the vein smaller and harder to access. Keep the tourniquet on for less than 1 minute to avoid discomfort and any potential issues. You can place a thin layer of fabric, like clothing, between the tourniquet and the skin for extra protection. And always keep an eye on the patient for any signs of discomfort. If you need to, there are other ways to make the veins more visible, like lowering the arm, tapping or rubbing the vein, or applying some heat.